Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Anna Halbert, and I am 32 years.
Okay, how may I address you?
Please call me Anna.
Okay, Ms. Anna. Today I'm going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay. During my discussion, I might take down some notes which will be strictly confidential. Is it okay?
Okay, doctor.
Okay, so Ms. Anna, can you please tell me what brings you here today?
Doctor, for the last few weeks, I have noticed that I am feeling somewhat dizziness. And first, I thought that it is due to my diabetes, but I frequently checked my diabetes. It was totally under control. Even with that, I am having this type of dizziness. And after that, I visited my GP. He said that it may be due to some over stress that I am having recently. It told me to some remain somewhat relaxed and told me to follow some basic maneuver to follow during that event. I tried to follow those, just like remaining calm and not too much worry. But that is not solving my problem, and I think that this is getting worse day by day.
Okay, I'm very sorry to hear. I will try my level best to find out what's troubling you. May I know that is this the first time in your life that you have been facing this problem?
Yes, doctor.
Okay. And can you please elaborate more that what you do mean by dizziness?
Okay, doctor. I feel that I am going to fall down when I try, when I stand from the sitting or sit from the lying position. At the time, I feel that I am feeling lightheadedness and I am going to fall down. So I haven't ever fail, but I think that I fall down. I feel somewhat lightheadedness and I cannot explain totally. I feel at the time that
Oh,
my vision is getting hazy. I feel somewhat happening with me, and that persists for a minute or sometimes a few minutes, and after that I feel better.
yeah, I'm very sorry. Well, actually, can you please tell me that for the few weeks has this problem been all the same, or have you noticed any change that
It is
previously you
increasing,
felt
doctor. It is
like
increasing.
increasing?
Initially, it was present, especially in the evening time or something after from the long walk. But it is now it is present all the time when I try to do any suppose change the position. At the time, I feel that.
Okay, I can get it. And can you please tell me that before this problem starts, do you feel any warning signs like
No,
any flushing or any nausea, anything like
no,
that, any
no,
vomiting?
no.
Okay, any problems in your vision?
At that time I feel that my vision are getting hazy, that is it is become somewhat gloomy, but nothing else.
Okay, gloomy. Sorry, can you just repeat?
Yes, doctor, it is
Okay,
hazy.
gloomy.
Yes, I cannot
Okay.
see it totally, just like that.
Okay. Okay. Have you ever felt that you have lost vision of any eye?
No, no.
Okay. And during these episodes, well, can you please tell me that for how long have you felt that these episodes usually take place? You told that after 1 minute or two you feel normal. Is
Yes,
this duration the same all the time?
no, it is increasing. Initially it presents suppose for a few seconds, now it is sometimes present for a few minutes.
Okay. Okay. I get it. I get it. And and you told that you have been facing this, and now it's quite for a few minutes. But can you please tell me that during these episodes when this occurred, do you feel any chest pain,
No,
any racing and pacing of
no,
your heart,
no,
any shortness of breath?
no,
Okay, any chest tightness or noisy chest,
no,
any cough?
no,
Okay, you told that you never have fallen down. But may I know that have you ever lost consciousness during these episodes?
no,
Okay, have you ever felt that there is any shakiness of your body parts during these episodes?
no,
Okay. Any tongue biting? Have you noticed?
no,
Okay. And any wetting of your clothes or something like that?
no,
Any abnormal sensation during these episodes?
no.
Okay. And after these episodes end, have you ever felt that that it is getting for how long? After how much longer time than that do you feel you are quite okay?
I told you that sometimes after a minute or sometimes after a few minutes.
After a few minutes, you feel that it's okay.
Okay.
And okay, and may I ask you some more questions now? That do you have any headache?
No,
Okay, any joint pain?
no,
Any skin rashes?
not skin rashes, but I think that I am developing somewhat dark skin nowadays. But I think that this is due to my recent travel.
Oh, I'm very sorry to hear. And have you noticed any oral soreness or any discoloration in the oral cavity?
No,
Okay, and any any raised temperature?
no.
Any changes in weight recently?
I think I have lost about 3 kg weight over the last 2 months. I told you that
Okay,
I am diabetic patient, so I always try to maintain my diet so less. I think
okay,
for that reason I lost weight.
okay, that's all right. Any weather preference?
No,
Okay, and okay, and may I know that do you have any uh, weather preference? And do you have ever felt any night sweats?
no.
Any lumps and bumps anywhere in the body?
I have lumps in my neck, and I have that problem for about last 6 years.
For 6 weeks?
Yes, years.
6 years. Okay, and have you sought any medical attention for that?
Yes, doctor. The doctor said that I have problem in my thyroid, and for that
Oh,
they are giving some hormone medication.
okay, okay. I can. And have you been under regular follow up
Yes,
for
doctor.
that? Okay, and is it under control, this
Yes,
problem? Okay, I can get it. And may I know that when what is first diagnosed this problem?
6 years.
6 years back, you told. And I'm sorry to repeat. Okay, and may I know that what about your water work? Is it all right?
Yes.
Okay, any frothiness?
No.
Okay, any? Do you have to wake up at night for your water work?
No.
Okay, and any what about any blood anytime in the water work?
No.
Okay, and what about your bowel movement?
I think fine.
Okay, okay, and have you ever passed out any blood through back passage?
No.
Okay, and may I ask you some questions now about your disease conditions? You told that you have some diabetes. Okay, may I know that how years how for how long have you been diagnosed as a
16
diabetic
years.
patient? 16 years.
Yes.
Okay. So I reckon you were quite young when you were diagnosed. So
Yes.
can you please tell me that what type of diabetes were you diagnosed with?
They said type 1.
Type 1. Okay, okay. And so may I know that for this diabetes problem, which medication do you take?
I take insulin. 2 types of insulin.
Two types of insulin. Okay. And has there been any recent changes in your insulin medication recently? Doses?
No.
Okay. And how about your diabetic control?
Diabetes control is very good, doctor. And even my doctor said that it is so good that my last HbA1c was 4.
Okay, okay. So that's a very good news, actually. Okay. And you told that you have some problems with the thyroid. And any other problems that you'd like to mention?
No, I haven't seen any.
Okay, okay. And that's all right. And may I ask that apart from taking insulin and some medication for thyroid, do you take any other medication?
No.
Okay. And any allergy to any medication?
No.
Any over-the-counter medication?
No.
Okay. And any medication through your blood channels?
No.
Okay. And any blood transfusion recently or ever?
No.
Okay. And that's all right. And may I know that do you have anybody in your family having similar type of conditions like diabetes or thyroid problems or any other problem like this? Do you have
Yes,
anybody in the family?
yes, doctor. My mother had thyroid problem.
Okay. And is she still alive? May I know?
Yes, doctor.
And how is she now with her problems? Is it okay or
She's fine with medication.
okay? Okay, and that's all right. And may I know that? May I ask you some personal questions at this moment?
Okay.
Okay. Do you smoke?
No.
Do you drink alcohol?
Occasionally.
Okay. Any binge drinking?
No. Never.
Okay. May I ask you that? Do you take any party drugs or any recreational medication?
No.
Okay. And what do you do for a living? May I know?
I'm working as manager at a private company.
Okay. So is this dizziness hampering your job?
Yes, doctor. So much because I have to frequently meet with the clients, meet with my boss, and at the time sometimes I feel the dizziness, and even at presentation I felt this two times, and at that time I think my colleagues and my boss got somewhat angry with me because at the presentation I had to
I'm very,
stop for
very
a while.
sorry to hear. Yeah, yeah, yeah. I am very, very sorry to hear. And if you want, we would like to involve the occupational health services in this matter so that they can help you out a bit more. Okay, will it be okay with you?
Okay.
Okay. And may I ask you some very personal questions now, if you allow me?
Okay, doctor.
May I know that whom do you live with?
My husband.
Okay. And may I know that do you have any children?
Yes, doctor. I, I have a male baby.
Okay. How old is he? May I know?
3 years.
I'm very sorry to ask, but may I know that have you ever had any pregnancy loss?
No.
Okay.
So many, so
And
many.
do you take any medication for not being pregnant?
No.
Okay. And have you been to any travel recently? You told that you had to travel recently. May I know to which country did you go
USA.
or where did you go? USA. Okay. And may I know that did you go to any caves or doing any thing like adventurous activities?
No, I went on a business purpose.
Okay. That's all right. And okay. And that's all right. And may I know at this that do you drive?
Yes.
Okay, and as long as we make a correct diagnosis, I think it would be better if you just stop driving for the time being. Will it be okay with you?
Okay.
Okay. At this point, may I know what your concern is?
Why I'm having this, doctor? Is it due to problem with my diabetes?
Okay, well, at this moment, I will actually have to examine you thoroughly and then also do some tests. But as long as I've taken history, I think that it's unlikely due to a condition of your diabetes. Okay, the condition of diabetes. But I think that it's rather might be a cause. It's rather caused by Addison's disease. Have you ever heard of it?
No.
Okay, please don't bother about the term. It's actually some glands, okay, which secrete chemicals. It's situated just above your kidneys, okay. Sometimes there can be some problems in this gland, and this the chemical that it's released from the gland actually helps to maintain our blood pressure and also keep us strong and fit. Okay, sometimes lack of this chemical can cause weakness and dizziness like you are having, and sometimes also some darkening of the skin like you are having. However, we will have to at first confirm it by doing some blood tests and all other tests, and there can be some causes okay behind this. It's maybe that your thyroid problem and diabetes may be linked with it, okay, with this Addison's disease. It sometimes occurs that our own cells, instead of attacking bugs, can attack our own body cells, okay. So our
I'm
defense system
up.
can do this. Okay. Okay.
Do you want to examine or go for the questionnaire?
Yeah, I would like to examine the patient. uh, okay, and first of all, I would like to have a look at his eyes, whether there is anemia present or not.
This is a surrogate, so proceed.
Okay, and then I would like to tell him to tell her to open his mouth and have a look at the oral cavity, and then I would like to ask her. I would have to ask her to tell me where specific the skin condition is, and then I would also like to check her knuckle regions, okay, and other pressure points to look for any blackening or darkening of skin, okay, and then I would like to have a look at her thyroid gland and just palpate it whether there is any tenderness present or not, or any nodularity present or not, and also I would like to have a look at his hands. Okay, to look for any a tremor, and also have a look at also feel his pulse, and then I would like to listen to his heart, and also to his lungs, and uh, and I would like to check his plantar and knee jerks, and I would like to complete the examination by measuring blood pressure and also measuring posterior blood pressure, doing urine for dipstick test, and also 24-hour Holter monitoring if needed.
Did you mention
Not needed.
abdomen palpation?
Oh no! I've missed that. Abdomen must be palpated, and abdomen must be seen whether there is any scar mark present or not.
Okay. So, have you reached at any diagnosis?
Yes, I think the patient is suffering from Addison's disease. Okay, and most probably it's due to autoimmune association, since the patient is also uh, associated with the type 1 diabetes mellitus, and also thyroid problems. I think it might be autoimmune polyendocrine syndrome too. I think in this patient. Okay, it's a possibility in this patient. However, there can be some other possibilities as well. Although uh, history does not go in favor of that, like tuberculosis or malignancy. This can even idiopathic and sometimes drug cause can also be caused, can also cause this problem, but it's unlikely in this patient. But however, I will have to rule that out first.
Do you have any other alternative diagnosis?
Uh, Apart from Addison's, I think the patient maybe suffering from postural hypertension for other causes like any diarrhea, vomiting, or any changes in medication, but there is no changes in the medication, and mm, and also I just can't remember now.
Do you think it can be a attack of hypoglycemic attack, recurrent hypoglycemic attack?
I think it can be, but there is no palpitation, uh, no other sweating or anything like that.
Do you think it can be presentation of thyrotoxicosis?
Thyrotoxicosis, yes, it can be, but no palpitation, no
Is it
changes in.
and also is it possible to have anemia?
Yeah, anemia was, I didn't rule it out, but
Okay.
others I think
Can it be a
don't.
presentation of autonomic neuropathy?
Yeah, it can be.
Okay.
Yes.
So how will you like to investigate her?
At the beginning, I would like to do some routine blood tests, including a complete blood count, and to rule out any anemia, and also look for any infection like neutrophilia and something like neutrophilia, and also like to do some inflammatory markers, including ESR and CRP. Then I would like to do uh, some specific tests, like I would like to do the thyroid function test, including TSH, T3, T4, also HbA1c level again, and RBS, fasting and random RBS, and then I would like to do a serum creatine level, serum electrolyte level, and also liver function test, and then I would like to do chest X-ray view and Monto test if needed. And for the diagnostic purpose, specific diagnostic purpose, I would like to do a short synaptone test in this patient. And I would also like to do some specific antibody testing, like anti-JAD antibody testing, and also anti-thyroid peroxidase and anti-TSH antibody testing.
Any adrenal antibodies? Any adrenal autoantibodies?
Yeah, 25 alpha hydroxylase adrenal autoantibodies.
27 and 21.
Sorry.
17 and 21.
Yeah, I think 17.
Okay.
Okay.
Did you mention ECG echocardiogram?
Yeah. I didn't mention echocardiogram. I told ECG.
Okay. So how will you manage this case? Okay, just one thing. Did you mention the genetic study?
Sorry.
Did you mention the genetic study?
No, I didn't mention the genetic study.
Okay. So how will you manage this case?
I think genetic study is needed. Autosomal dominant, I think.
How will you manage this case?
Okay. Okay, first of all, I will have to educate and counsel the patient. Then I would also educate and counsel the patient. Then I would have to form a multidisciplinary team involving involving occupational health therapist, then uh, then endocrinologist, and then endocrinologist, and then I would also I would have to go for a specific management. Like I will have to counsel the patient about having a steroid card. Okay, I will have to give him replacement,
What medic?
steroid
What
replacement.
are, why, who is a specialist will you involve in your participating?
For this, I will involve occupational health therapist
Okay.
and neurologist,
Okay.
endocrinologist.
Okay.
Okay, I think and I think they are important, and medicine specialist.
Okay.
And specialist nurse if needed.
Okay.
Okay, and then I would also like to start specific medication by giving him steroid. Okay, and I will also have to provide him steroid card or steroid bracelet, and educate the patient very well about taking them whenever he feels any stressed, or he might have to take double dose in case of any infection or any stress. I think I have to counsel him very well about
Okay. Fine. Thank
that.
you.
Okay.
In the history taking, I think you should have asked few more questions.
I missed the neurology part actually.
And
I
for
didn't ask about any specific weakness, any abnormal sensation, any
yes,
problem in swelling, swallowing, or speech,
yes,
and any difficulty in keeping balance. These questions were omitted. I just
yes.
forgot.
For dizziness, you find well. I cannot remember if you have asked about any aggravating or relieving factor,
Yeah,
like any
yeah,
stress that aggravates this condition. Patient said that she has a
yeah,
stress at work. Okay.
yeah.
And after that, there were something that in the past she said that one thing that her HbA1c was poor. Do you think it is normal?
No,
You
no,
haven't
it's
you haven't
actually
asked
less.
about it. And also patient said that she thought this is due to her diabetes and she measured it and this was too good. That means there was something abnormal. If you asked about that, if you have measured any diabetes at that
Mm,
time,
mm,
what was the level?
mm.
She would say you that okay, I find it 3.5.
Okay, okay.
So that this is due to that her adrenal gland isn't working, so her insulin dosage should be reduced.
Yeah, yeah, yeah.
And you haven't mentioned it, and that is she may need some review of medication right now.
Okay, yeah, 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 yeah.
And
I can get it.
okay, and also she may need to follow up some lifestyle management at this time. She also had history of recent weight loss.
Yeah, yeah.
So you'll have to follow some lifestyle. And also another thing that you haven't asked about excessive coffee or alcohol. So excessive coffee or tea. That was not a
Mm.
big deal, but you should have asked for that, I think.
Yes, I should have asked a lot. I just I was not so much good in this case actually. So what was the case actually? Was it Addison's due to APS?
Yes.
Okay, but these differentials were very prominent, but I didn't. Okay, however,
And differential
and
for the differentials, you should go for the differential for dizziness, not for the postural hypotension. Or if you find that for postural hypotension you have differential, go for that. No, not diarrhea, vomiting. The patient had no history of diarrhea, no history of vomiting. Why are you going for that? And also,
Yeah,
one important thing, you haven't asked about any abdominal pain. This patient had history of abdominal pain
mm,
that is common with Edison's.
yeah, yeah. Even it can be associated with primary hyperparathyroidism in APS.
If it was type 1
Yeah,
hypoparathyroidism in type 1, it was type 2.
yeah. However, but I should have asked, I think.
Yeah, any history of previous surgery, any history of surgery in the family, any history of cancer
Mm,
in the family. You should also go for that.
mm, yeah, 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 yeah. Okay. Okay.
This case was somewhat
So that,
straightforward, but there was something that you should have asked more details, especially about the past history and
yeah,
history. They are important.
yeah, that was a very good case actually, and I didn't do well. However, I think the recording can be stopped.